Thank you so much for watching part 1. Now, moving on to the right side, since the sequence is pretty similar and I've already covered the main points, I'm going to dive into a detailed look at the information you should be gathering during the warming phase. Let's jump right in. When you're warming up the back, you are also palpating. You're gathering valuable information about the muscles and tissues, preparing them for deep work. Pay close attention to texture and density. Healthy muscle tissue should feel smooth and pliable. As you move across the back, areas that feel dense, rigid, or ropey may indicate tension of adhesions or trigger points. These rougher or more fibrous spots can signal where the muscle is more contracted, so take note as they may need more focused attention. Temperature variations can also tell you a lot. Warmer areas often suggest increased blood flow or inflammation, while cooler areas might indicate a restricted blood flow and would benefit from circulation boosting techniques. That's why it's so critical to warm the back up thoroughly. Use this information to adjust your warming strokes or circulatory techniques based on the needs of each spot. Assess for any asymmetries between sides of the back, as differences in muscle tone, tension, or thickness can reveal postural imbalances or habitual movements on one side. When you notice asymmetries, consider spending extra time on the tighter or thicker side to address these imbalances. As you palpate, stay alert for trigger points and knots. These will feel like small, tender nodules that don't soften easily with initial pressure, and pressing on them may even cause a jump response or discomfort to your patient. Sometimes you'll notice referred pain. Your client might feel pressure in their shoulders or neck when you press on the upper back points. Also, pay attention to muscle mobility and elasticity. Healthy muscles will give under light pressure and bounce back without resistance, while stiffness or resistance can indicate chronic tightness or restriction. These areas will benefit from focused, gradual work to release them. Remember to locate bony landmarks like the spine, scapulas, and ribs, which will help you navigate the muscles' attachments. Around these attachment points, you may feel tension or pulling, indicating that certain muscle groups could be affecting others. Throughout this process, take note of your client's feedback and sensitivity. Ask if any areas feel tender or uncomfortable, and watch for non-verbal cues such as flinching, shallow breathing, or muscle tensing. As I was warming up, I noticed some hypertonic areas in the right lower back near where the erectors attach at the superior angle of the iliac crest. To explore this further, I used my thumb to trace along the lamina of the longissimus, staying close to the spine to feel for any differences in texture or density. Then, I switched to small thumb circles over the spot to isolate and address the tension there. During this, I checked in with my patient, asked if she felt any tightness or tenderness. She initially reported no pain, but with a bit more pressure, she noted some discomfort and realized this area was a lot tighter than expected, even though her left side had been the main concern. Anytime you pause to work on an isolated area, always follow up with some petrissage or effleurage strokes to keep the flow of the massage intact. Notice that I rarely lift both hands off the body. It's a small but impactful detail that maintains connection. And if possible, try to add more oil without ever lifting one hand off. It's trickier than it looks, but it feels incredibly smooth and intentional. Your client feels more than you realize. The small details is what really sets you apart from the rest, I promise. This technique is wonderful for releasing tension between the shoulder blades, an area where the majority of all of your patients carry stress. I can assure you, almost everyone who gets on the table has tightness here, so take your time to hone your techniques in this zone. You'll focus on 3 key muscles: the rhomboids, the middle and lower fibers of the trap, and the levator scapula. The rhomboids connect the spine to the inner edge of the scapula, playing a major role in pulling the shoulder blades back and maintaining good posture. Just above, the middle and lower trap fibers help retract and stabilize the scapula, which is crucial for shoulder support. Finally, we have the levator scapula along the sides of the neck. This muscle elevates the scapula and is often tight from prolonged sitting or stress. Targeting these muscles with intention not only feels amazing for your patient, but also helps open up the upper back, setting a foundation for deeper work and relaxation. It's so important to bring diversity into your strokes, using a range of techniques, flow patterns, and varying pressures. Mixing things up keeps your patient engaged and lets you address different muscle layers and textures effectively. For instance, combining long flowing effleurage strokes, effleurage. Okay, let's try this again. Combining long flowing effleurage strokes with targeted kneading or thumb work on specific area creates contrast that's both therapeutic and enjoyable. When you introduce variety, it keeps a sense of rhythm to your massage, a natural flow that keeps your patient grounded but curious for what's next. You know the area's ready for deeper work when there's light pink hue on the skin. This signals that blood is increasing, and the tissue is warmed up and ready for more focused pressure. Changing up your pace and pressure also allows you to gauge how the muscle responds, enabling you to adjust your technique as needed. For instance, pay attention to whether the muscle responds better to acute, firm pressure, or if it prefers a broader, slower strokes. Some patients may even appreciate more repetitive, light work. By tuning into these preferences, you can tailor your approach to ensure a more effective and satisfying treatment. Now that the back is thoroughly warmed up, I return to the primary area of concern for my patient, the left low back. Using my thumb to glide along the lamina of the erectors, I simultaneously apply pressure with my fingertips on my left hand. To create a balanced and effective stroke, unify the thumb and fingers, moving them as a single unit to deliver broad yet precise pressure. This technique allows you to target the deeper layers of tension while maintaining a smooth and controlled flow. Be sure to finish the stroke by transitioning seamlessly over the upper glutes, as tension in the low back often extends into the glutes. Elegantly transition to the left side of the body, keeping your movement seamless and connected. Now, let's add some more targeted work. Transition into an ironing technique. Starting with a soft fist, rotate your arms so the thumbs are facing downward, applying pressure laterally with the thumb while simultaneously using the knuckles of the pointer and middle fingers to deliver that pressure. Focus on sneaking into the space between the ribcage and the top of the pelvis, targeting the QL region. Be mindful of the contours of the body, adjusting the angle of your fist to maintain a smooth, consistent pressure, fist over fist. Don't forget to include the upper glutes in your strokes, as this area often shares tension with the lower back. As always, use your body weight and leverage to control the flow. Using my right thumb, I glide along the lamina of the erector, tracing the length until I meet the pelvis. Once I locate the edge, I anchor my position by pronating both arms so that my thumbs meet in parallel. From here, I move laterally with deliberate, intentional pressure, ensuring the stroke remains focused and effective. As I reach the end of the stripping stroke, I transition seamlessly to using my fingertips, bringing the index and middle fingers back towards the center. Before each stripping stroke, take a moment to visualize separating the muscle fibers from the spine. It will help guide your technique with precision and pressure. Be aware that when the longissimus is hypertonic, it can sometimes cause a twinge or a reaction of discomfort in your patient. If this happens, soften the pressure when you traverse the longissimus, allowing the muscle to release more gradually. Start with about 30% pressure and gradually increase from there. The lower back is particularly sensitive to the role in stabilizing the body, so always listen to your patient's feedback and adjust accordingly. Remember to incorporate transitions like broad effleurage or gentle petrissage to tie your focus work back into a larger flow of the massage. This technique is similar to the last, but now focuses on working with the direction of the muscular fibers. Using my left thumb, I find a stable anchor as closest to the pelvis as possible. Then, I stack my other thumb directly over to apply deeper, more controlled pressure. To maximize effectiveness and avoid strain, keep a gentle bend in the working thumb. It helps maintain strength without compromising your joints. As you restart each stroke, always maintain pressure on the body to keep the flow uninterrupted. Switch thumb positions for each stroke to ensure a seamless transition and to distribute the workload evenly between your hands. Thanks for tuning in to part 2. If you haven't caught part 1 yet, I highly recommend checking it out. And hey, if you learned something, consider subscribing. Now's a great time. Don't forget to give that like button a little support. Adios, till next time.